Hello friends, in this video we'll talk about the gross anatomy of the penis and applied aspect. This is the last part of the male external genitalia. First we talk about the features, the blood supply, lymph supply, applied aspect. So first we talk about the features. Here you're seeing the structure in the coronal section. The glands finis, this is corona glandis, this is the neck of it. The two corpus cavernosae and the spongiosum in between. This is the body of the penis. Root is formed by the crura. We have crura in the ear also. Okay. Remember that is a different crura. Here the crura is, here this is the crura. And bulb. And this is the perineal membrane. Okay. Now this is the sagittal section where we have the important navicular fossa, EUM, just like auditory meatus in the ear, we have the urethral meatus in the penis. Okay. Here the intrabulbar fossa between the bulb of the penis and the spongiosum. I mean the corpus spongiosum, we have the intrabulbar fossa. This is the crux of the penis. Okay. And here, let us see some more features. Here we are finding the root of the penis. This is covered by, the bulb is covered by bulbospongiosus muscle. What is meant by this? Bulbo means bulb. This is a spongy muscle covering the bulb. And which is covering the crura is the ischiocavernosus muscle. So remember two muscles, ischiocavernosus and bulbospongiosus. Let's see the transverse section through the body of penis. Here we are finding the cavernosa, corpora cavernosa, the arteries of the penis, the spongiosum, the urethra, then the outer skin and the fascia. Okay, superficial and deep both. Okay. Then the dorsal vessels and nerves. Here you are finding this part, the dorsal vessels and nerves. Okay. Now, this is to show the glands finis. Okay. So now let us see. This is the glands finis. This is the prepuce, the preputial sac, the urethral meatus and the frenulum. Frenulum is there in tongue also. Okay. That is a different frenulum. Here this is frenulum of penis. This possibly is the penis artery. Okay. Okay, so these are the glands finis. Here we are seeing the ligaments. We are also seeing the ligaments here. The suspensory and the fundiform ligaments. These are the two to remember. Suspensory and fundiform. Not fungiform, it is fundiform. Okay. Fungiform is different. That's a papilla. This is fundiform. Fund. Okay. Now the blood supply. Let's see the blood supply and the lymphatic drainage also. First, blood supply. We have the dorsal vessels and nerves here, along with the, and there are some other structures like arcuate pubic ligament and the transverse perineal ligament. So in blood supply, I want you to write the dorsal vessels and nerves with this diagram. Here also, this is the superficial vessels. We have the pudendal and the dorsal vessels. Here blue is the vein, red is the artery. This is the pudendal and this will be the dorsal. So pudendal and dorsal vessels. Okay. Now the lymph supply and the applied aspect. So it is supplied by the cloacae and inguinal lymph nodes. Cloacae lymph nodes I have shown you in the femoral sheath. The medial part of the femoral sheath is having the cloacae lymph nodes. So cloacae and inguinal lymph nodes. Applied aspect we will discuss too in brief. Phimosis and circumcision. Phimosis is the narrowing of distal end of prepuce and retraction failure of glands finis. Just remember there is a narrowing in the prepuce that is affecting the glands finis. What happens? There is a difficulty to urinate or micturition is affected in scientific terms. Then circumcision. Scission means removal. Incision always is removal. Okay. What is removed? Prepuce. We have seen no the prepuce. The removal of that prepuce is called circumcision. Okay. These are the references from where I took the images. That brings us to end of the video. So with this, we end the discussion on the male external genitalia. So thank you so much. I'll see you in the next video.